On this episode of Africa Health Check,
the most important thing the government should do should be able to establish accessible health centers for people in the community.
There's a lot that the government can do when it comes to access to health. Number one, let there be drugs in hospitals.
We review the continent's health system response capacity.
To the governments of Africa, particularly West Africa, is that please, this is the time to invest in health.
And discuss Africa's preparedness and response to emerging infectious diseases. One of the biggest challenges that was exposed by COVID-19 is how unprepared many of our healthcare and social services sector in Africa were for the COVID-19 pandemic. On today's episode, we will be discussing preparedness and response to infectious diseases. I am your host, Hohontlejang Paladimorokozo, and I welcome you to Africa Health Check. I am joined by our experts, Dr. Marianne Mureithi, the chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. But before we hear from them, let us have a look at this episode feature story.
We were very lucky that, it's as if the Ebola was waiting for the Nigerian Center for Disease Control to be established. As soon as it was established, that means the Nigerian government had created a structure, an infrastructure of a national public health institution that can quickly be mobilized to respond to such emergencies as Ebola. So we were, on the spot. As soon as the virus entered Nigeria, within 24 hours, Nigerian Center for Disease Control landed in Lagos, and they have started instituting response mechanisms, to curtail, the spread of the virus into the large Lagos population. One of the greatest, tools used, to put Nigeria ahead of the virus is the fact that, using the NCDC and the role of the Honorable Minister of Health that time, or the Minister of Health, enabled Nigeria to put a very formidable, fighting mechanism with very well coordinated response, starting right from the president up to the level of the NCDC and then the state governments. The success of the Nigerian CDC gingered many African countries to establish similar national public health institutions. And the West African heads of states and presidents came together the first time 2014, 2015, and said there's immediate need for a regional center for disease control, and they assigned Nigerian CDC to assist in establishing it. So I was, also the national coordinator and the executive director of the NCDC, and at the same time, acting executive director to establish the West African CDC. So it was during my time that we established what we call disease surveillance and notification system, which means we now realize that, instead of waiting for the outbreak to occur and we go and investigate and start running helter-skelter like firefighters, we are now started identifying diseases that must be notified, that must be followed, and that must be, prepared for. And that's really brought, to the table the fact that this is a national activity. Nigerian government must immunize her own children and should not rely on any donor for vaccines and for cold chain. And that we raised almost $200 million that time, to put some of these mechanisms in place. Whereas before then, Nigerian budget for childhood immunization was never up to $1 million. We should own whatever challenge or success that we're having. That is to make sure that, one, we have the tools and wherewithal to fight this emerging, and reimagine, new diseases like the Ebola, as we have seen, like, Lassa fever, like COVID, like meningitis, etc., and so on and so forth. One is the funding. That's number one challenge. Initially, we were depending mostly donor, but now, to some extent, the Nigerian government is, putting more emphasis on funding such mechanisms. And then the second one was lack of infrastructure, adequate infrastructure. But with the advent of the NCDC and now more public health establishments, are now coming up, both in the universities and even private sector. As you can see, the fight against Ebola in Nigeria was fought and was succeeded because of the collaboration between the private sector, the hospital where the patient was first diagnosed, and the public sector. So that collaboration is very, very useful. My vision for, the disease prevention and control for the African region is to have a little bit more expanded and multi-sectoral approach, not only at national level, but at regional and continental level. And this is what has led to the establishment of the ECOWAS CDC and the African CDC, where I played key role, in making sure that it was established and empowered to do so many things. And now we are very proud of these establishments. One thing that we should always learn to do is the example of the Ebola, in particularly COVID, whereby we have to be self-sufficient. If we are not self-sufficient, we have the outbreak, we don't have the vaccine, we don't have the diagnosis, something and so on. So we are relying on outsiders to give you. And that means, he who pays the piper, dictates the tune. So you will have to wait until, they give you. So the governments of the region and of Africa, particularly West Africa, is that please, this is the time to invest in health, for health is wealth. And if we do not actually, get things in place and regard these emergencies as health security issues, we shall be paying dearly and we might not be able to mitigate their impact.
Such a really powerful story, sharing a success story of Nigeria's Center for Disease Control, and also highlighting some of the biggest challenges or vulnerabilities that are existing in Africa generally with regards to responding to infectious diseases. And I want to turn to my panelists, and maybe let me start with you, Dr. Mary Ann, because I want to make sure that we're all on the same page and we give viewers an opportunity to really meaningfully engage. When we're talking about infectious diseases, what are we referring to?
Yes, thank you. I'm very passionate about this topic, and it keeps me awake at night thinking of how best to prevent these infections. So infectious diseases simply are those diseases that can be transmitted from one person to another, and they can be transmitted via various routes, so either through a droplet or through breathing in air that is carrying these viruses or bacteria. COVID was one of them. Tuberculosis is another one. It can be transmitted by dirt. So if you're not washing your hands well, these bacteria or viruses can stick to surfaces, and then you introduce them to you either through feeding or through putting your hands in the mouth. That's another way an infectious disease can be transmitted from one person to another. Another way, we call it a vector. We can also use a vector such as mosquito, such as a fly. A fly can land on feces or something else that's contaminated. And right now we have a huge problem in Africa, particularly in northern Kenya and East African region because of flies. Flies transmit this infection called trachoma. Trachoma leads to blindness. So these flies, they get into contact with that organism. It's called chlamydia bacteria, and then it lands somewhere near the eye. and then again now this person suffers a sequel of events that may lead to blindness. So that's another way of transmission, consuming water that is contaminated. So there are various routes, and unfortunately in Africa we have the highest rates of infectious diseases in the world.
I want to get to you, Reverend. Perhaps maybe you could highlight some of the major drivers or contributing factors to the spread of infectious diseases in Africa generally.
Dr. Mariam has highlighted, for instance, dirt, sanitation, and there are many other factors, ecological change, climate changes. There's a whole wide range of things that bring these things about, actually. Yes.
Absolutely. And when we're looking at the video from Nigeria, CDC was talking about some of the key challenges that they experience. And I believe they're actually not unique to Nigeria, but they're actually challenges that a lot of stakeholders working in response to infectious diseases or just generally in public health face. And I would want you, Dr. Marianne, since you work mostly on this issue, to maybe highlight what are the key vulnerabilities that make us unprepared, ill-equipped to respond to infectious diseases. Just the key vulnerabilities. I'm sure there is a wide range of them, but the dominant ones.
I'm even laughing because of that question, because for me, there are three, but they all want the same thing: finances, finances, and finances.
Yes.
So if we had more funding, we would be able to, again, detect these infections, respond, do active surveillance, and then have mechanisms to report this, mechanisms to treat. So really, that is our biggest challenge. We have funding to be able to help this, mitigate some of these shortcomings will be fantastic. But nevertheless, despite those challenges, I feel particularly in East Africa, just as we have watched, we have a very active surveillance that started way before COVID hit us. Why? Because of Ebola. We are in the belt that experiences a lot of Ebola. And again, if you look at the epidemiology of such diseases, they start off in dense forested places, and that one of them is the Congo forest, where some of these organisms may originate. So again, we've had very active surveillance in our borders: Uganda, Kenya, Tanzania, Rwanda, Burundi. That's in the East African region, and that has been ongoing. We've been able to detect Ebola when it's just one case. That's fantastic. We're able to detect outbreaks of yellow fever or Rift Valley fever when it's still contained in one place. So despite the challenges I've said, finances, we have people on the ground. We wish we had more human resources. We want to wish that more people get educated on how to report, how to detect, and how to prevent some of these infections. So if in summary, I would say finances, having more personnel, and then creating awareness. Those are our key challenges, and we can overcome that. I think would be way ahead than we were even before COVID hit us.
Absolutely. But what is wrong with the finances? I mean, in most countries in Africa, the Ministry of Health actually gets the lion's share of the national budget. So is it that the money is not there? Is it not enough? Or it's not going to the right places? Because we do know that ministries of health get allocated the largest share of the budget to a large extent.
I believe that knowledge is power over here. People need to know how these organisms live, how they operate. The history of pandemics, infection and breakout, tells that organisms keep on changing all the time. And diseases are coming out all the time. So there must be a political will to buy into the discovery and the research of science that these things are happening and they are not good for our society. So then we are investing the money that she's talking about, not only into research, but also into how to contain these things. And it's not there. Not many people believe that these organisms are ever changing. Think of COVID-19. Before we know it, we have the variant, Alpha, Beta came, Delta came, Gamma came, and
Omicron.
from there you have the XB and all those things. So they keep on changing.
Mutating.
And until all our stakeholders and all these people know that this is the world we are in, nobody is willing to commit a dime to anything.
That's true, and I hear you, but I still feel we haven't touched on thoroughly the role of other stakeholders, of civil society, of activists in influencing that this is high on the political agenda, that we domesticate, institutionalize these human rights treaties that compelling our governments to commit sufficient budget funding towards public health. Clearly, there has to be a role. There's something that we can do to influence that in our different spheres of influence. So I want us to touch on concrete, actionable initiatives that can be undertaken by the general public and different stakeholders to influence this. We're going for a quick break where we will hear what the people on the streets have to say about this. Stay tuned.
I feel like people should adhere to sneaking vaccines because they are scientifically proven to be the best, and we should all be administered with them from the young age up until the older.
When it comes to social economic impact and psychological impact of the pandemic, especially COVID, I think it left a huge impact in Africa. Personally, I lost a number of friends and also relatives. But when it comes to psychological impact, I have seen children who has lost parents and they are not working.
Watu wengi wanaweza kuaccess healthcare services. Hospitali zimejengwa na unajua ni devolved function. So counties zimejaribu kujenga mahospitali hapa na pale, so watu wanafikia hali ya matibabu kirahisi.
Welcome back to the show. You're still watching Africa Health Check, and we are discussing the unpreparedness of African countries when it comes to responding to infectious diseases. And just before then, I was just asking if you could perhaps share some of the actionable activities, initiatives that can be undertaken by public health experts, practitioners, and the general public to influence more investments to go into this area that is definitely critical. Dr. Marianne.
Yes, and that's a very good point of discussion because we've probably touched a lot about government, but there are non-government organizations really championing these public health campaigns and also trying to make sure that we don't see any emerging and re-emerging infection. For starters, I would start with what comes right into my mind. Of course, we have the CDC, we have the MasterCard, we have Bill and Melinda Gates Foundation, particularly who have been going around the continent just talking about what you call mosquito nets, sleeping under the nets. And why is that? We are trying to get hold or trying to prevent malaria and other infections spread by mosquitoes. And it started like a very simple message, but now it's really gained momentum because again, it started with the non-government organizations, but now we are seeing that our governments are now picking up the pace because we receive a lot of donations, mosquito nets and so many other things to prevent, for example, malaria. Then the government, then once they receive that, then they do the distributions in villages, in places out there. And they don't just go there, they use community peer leaders, they use community gatekeepers like chiefs, because again, we had an example where some of these nets were donated, but the fishermen were like, oh, this can be used to fish. And so when they came back to do a review a year later, the malaria rates were still high. And so again, government, the NGOs, but also the local communities. We have also at the university a program where we go around urban areas and try and teach people about safe waste disposal. For example, tires. When you go to a mechanic's area where they keep the tires, they look very nice maybe for the mechanic, but they're very good mosquito breeding grounds because the tires will attract water, the water is still, it's warm, mosquitoes will lay eggs, and malaria will never end in that community. So as much as, yes, there's funding, the government is doing much, we also have a role to play from the universities, the infectious diseases experts, the local community leaders, the gatekeepers, the chiefs, the teachers, we all have a role to play Absolutely.
And perhaps maybe that brings in also the intersectionality of the socioeconomic challenges that people also face. You know, do I prevent malaria or do I go and catch fish? You know, and how they say it's very hard to empower somebody who's on an empty stomach because their present need is actually being fed, you know, and then anything else becomes secondary to that.
Yeah.
Reverend, earlier on we're talking about some of the commitments that our countries have made, the 3% of the budget to research and development and 15% to health that is currently not being achieved. How do we hold our leaders accountable to actually make sure that they follow through on these commitments?
Unfortunately, you cannot take them to court. In the punitive. The only thing is to do with your thumb, vote them out. Yeah, especially as Dr. Marianne said, when the knowledge has come, when there's a revelation that if we do this, this will be the result. I think there should be policies backed by law.
Yes.
And the law should not be relaxed. So people can get away with it. For instance, she cited the example of used tires. If it's left in the open and the water goes into it, it's a breeding ground for mosquitoes.
Yes, yes.
It is researched, it's known. So then a law can be said that if we find a used tire, lying around,
yes, you'll be penalized.
You'll be penalized for it. Yeah. And they go through with it.
Yes.
It will become a deterrent for people to practice that. Now, people get away with a whole lot of things. Fly tipping, throwing, waste all around. If they were caught and disciplined, I'm not sitting on this thing to say that our government should punish us, but that is not what I mean. But if it will bring the result, that's because you go to Ghana. For gold prospecting, this thing, they have something called galamsey. It's a kind of a minor scale. All our major rivers are like dirt now. Why? Yeah. Because the way they treat the water with mercury and other things kill the fish, the ecosystem, everything is like, and people get away with it. So if we could keep eyes on each other concerning some of these things that we're talking about, then we'll be able to police ourselves and keep ourselves in the right place.
And it's not so much punishment, but just deterring certain behavior. Because I think some of these things ultimately boil down to personal responsibility. What are you doing at an individual level to contribute to that? Because some of these spread simply because of our lack of us taking personal responsibility for our actions. So I think we do need to preach that a lot. Personal responsibility, social responsibility, accountability, and so on and so forth. And as we wind down on the program, I wanted us to discuss how to amplify the great initiatives that are currently ongoing on the continent, as we saw in our feature story in Nigeria CDC. So we know that agencies like the World Health Organization, MasterCard Foundation, and Africa CDC have actually embarked on several initiatives to help countries with early detection, surveillance, and responding to public health emergencies. But how can we amplify these initiatives? How can we ensure that they are rolled out and leaving no one behind, and every country also has an opportunity to implement these initiatives?
Well, for me, I really wish we could focus more, once we have these initiatives in place, have what we call community engagement, or what we call scientific citizenship. What does that mean? We are engaged, we are engaging with all members or all sectors of the community. Once these initiatives are discussed, once they come out, how are we cascading that information? How are we talking about there's a malaria vaccine that's been rolled out at the moment in Kisumu, but how is that lady in Kisumu in the deep villages going to know that there's such a vaccine that can save her baby's life? It's just through community engagement. How do we do that? We need to have all sectors playing together. And again, we've watched the presenter really talking about interdisciplinary approach, or transdisciplinary, where we have all those members, scientists, government, NGOs, the people charged to run the initiatives, all sitting on one table so that we're talking to each other. Media also has a very big role to play. In example, in our villages, everyone has a radio. Everyone can listen to a radio. Everyone will listen to an advert. And now, for example, in the Kenyan TV and radio spaces, just before the 9 o'clock news, where most of us are seated at home watching news, we have an advert on, for example, again, malaria, where we have Doom. You know the Doom spray? Yes. And we have a mother with a baby, the net, but she's talking about Doom, and I really like that. We also have other health initiatives, adverts, again, going through during those peak prime time, coming in, talking about maybe washing of hands. During COVID, there was a lot of talk about vaccinations, wearing of masks. So again, if we have such a drive where all sectors are working together, we'll be able to amplify what we're seeing, the fantastic work the MasterCard CDC Foundation are doing, what we're seeing WHO doing, and many other initiatives that are in place. I think we'll win, and I think we're already on that success route. We just need all of us to amplify that message more and more again.
Wonderful. Reverend, you'll have the final word.
Yes, what I would say, the diseases are coming up every day, every hour, and we take our destiny into our own hands. Science has proven that if we don't do early detection, early surveillance, we run a risk of shooting into our legs, because we are looking for health, the opposite will take place. Now, there is a story I was sharing with Dr. Mariam and before we came here about a smartphone application in Tanzania, where I think it's with the support of CDC. I'm not too sure. Yes, where they can detect minor sicknesses here. I don't know how and they have rolled it out and it's working. It is somebody's innovation. It's somebody's research that has brought this up. So it's possible that if we have the will, there will be a way, for us to stem these things in the back.
Absolutely. And the truth is that, as Africa is rising and growing, a lot of people are coming up with brilliant, innovative ideas. There's this current wave of coming up with African solutions to African problems, and especially young people do not want to be left behind. I think it's just a matter of ensuring that we create a fertile environment for these innovations to actually thrive, for these innovations to actually get into our communities and improve the human and social development outcome. So thank you very much for that. We've come to the end of our program, but before we wrap up the show, I'd like us to take a look at our African health champion for this episode. We highlight a group from Kenya that helps recruit and empower health champions in the MSME ecosystem. Have a look.
In Kenya, a remarkable initiative known as Zwena is weaving together a tapestry of health and empowerment. With a vision that spans across the continent, Zwena Group is dedicated to nurturing a network of health champions, trusted community members driven by a shared purpose to uplift and empower their local communities in matters of health and well-being. Zwena has crafted a USSD-based curriculum. This dynamic curriculum revolves around a central theme: the significance of COVID-19 vaccination and the role each individual can play in championing public health. Through interactive sessions, Zwena's health champions will educate their communities on the importance of vaccinations, reinforcing the interconnectedness of health and inspiring collective action.
Really commendable work in Kenya, and I hope you have been inspired. That brings us to the end of today's episode. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories we highlight here. Connect with us on Facebook, Instagram, Twitter, LinkedIn, and YouTube. The channel is Africa Health Check. Until we meet again, same time, same day, same place, remember that the future is Africa, the future is today.